Good morning, good afternoon, good evening. On behalf of the International HPV Awareness Day Campaign Committee and the International Papillomavirus Society, I'd like to extend a warm welcome to our panelists on today's webinar, and a big thank you to everyone who's participating from all around the world on this webinar. This is one of our key campaign events, which I'd like to briefly introduce. Today, March 4th, is International HPV Awareness Day. The campaign was initiated by the International Papillomavirus Society 5 years ago, with the goal of addressing what we thought was a key gap in global efforts to prevent morbidity and mortality from HPV-related cancers, namely trying to start a conversation focused on the causative agent itself, human papillomavirus or HPV. While there are some challenges associated with talking about HPV specifically, there are also some very real benefits. The first is that it allows us to remind the public that HPV affects everyone. Either you get it yourself or someone who you know or care about gets it. This affects both men and women of a very wide span of ages. This helps to remove stigma, and that is a really, really important benefit. It allows us to talk about actions that can be taken to reduce harms from HPV in a broader context, not focused on one specific cancer, but the range of cancers caused by HPV and a range of methods to prevent harm from those cancers, namely vaccination, screening, and treatment. In the context of the COVID pandemic, it allows us to leverage heightened public awareness about viruses in general, concepts around vaccination, herd immunity, public health measures. It also gives us the opportunity to remind people or to tell people for the first time, in fact, that there is a virus that's been around for a long time before SARS-CoV-2, the cause of COVID, which can cause cancer, but for which we already have the tools to beat. So today, even as we're saddened by acts of cruelty and violence, there are a number of events being held all over the world to mark International HPV Awareness Day. These are performed in partnership with more than 120 organizations around the world. They include a wide variety of events. We're having Zumba dancing in Singapore. We're showing IPV, IHAD videos in the Shibuya crossing in Tokyo. We're having lectures, we're having rallies, we're having social media posts. There's a lot going on in many different languages, in many different groups all over the world. Truly an exciting event that is truly global. The goal of the campaign actually is to provide information which will attract people's attention, not so much to give them everything they need to know about HPV at this point, but to attract enough attention to stimulate them to get more information, the kind of information they can use to prevent harm from HPV-related cancers by going to the International Papillomavirus website and or the websites of our local partner organizations. So this is really just the first step in the conversation, and today is the focal point of the conversation, but we will be having this conversation year-round as part of the campaign. So reflecting on things that are going on today, we are reminded that we can achieve so much when we work together, and that together we can reduce suffering from a virus that kills hundreds of thousands of people each year. The 2022 International HPV Awareness Day theme is one less worry. We can help the world to have one less worry by learning about and talking about HPV and using the tools that we already have available to help eliminate HPV-related cancers. As many of you know, the World Health Organization has a cervical cancer elimination campaign that has 3 pillars. These include vaccination, screening, and treatment. Each year, the International HPV Awareness Day campaign will kick off with a webinar such as this, and we will rotate themes for each of these 3 pillars. The theme for today is vaccination, and it's my great pleasure to turn the proceedings over to our host, Katja Iversen. Katja is an internationally recognized author. She has more than 20 years experience working in NGOs and various United Nations agencies. Previously, she held the position of Chief of Strategic Communications and Public Advocacy with UNICEF, and also led the team responsible for communication on reproductive health at the United Nations Population Fund. She's got lots of degrees. She's got a master's in communications and a bachelor's degree in public health administration, certificates in management, conflict resolution, and international development. I think you can see why we thought she would be such a wonderful host for today's webinar. Katja also was the leader of Women Deliver until 2020, and overall has a lot of experience in global health and advocacy for women. And with that, we are grateful that you selected us to be with you today, and thank you very much for leading today's proceedings. Katja, over to you.
Thank you, Joel. My absolute pleasure. And good morning, good afternoon, good evening, no matter where you are, who you are, and what you are. Welcome to this exciting panel debate, Delivering a World with One Less Worry, on International HPV Awareness Day. Did you know that HPV vaccines are close to 100% effective in preventing HPV infections? And did you know that with a combination of vaccine, screening, fighting stigma, and treatment, we can prevent HPV and greatly decrease the various cancers and hundreds of thousands of deaths it causes every year? And did you know that if we want to, we can alleviate a lot of suffering and millions of worries about this? And do we need that today in the world that we look at? We can create a world with hashtag one less worry, and that's what we're going to talk about today. I'm your timekeeper, I'm your moderator, I'm your instigator, and I'm maybe also sometimes your troublemaker. And with me, I have an amazing panel of passionate and super professional and personable people from some of the smartest who, together with all of you, can create that world. Let me do a quick introduction to who you see on your screen. It's Marcia, and across the Golden Globe and Emmy Award nominated American actress, an amazing advocate, cancer thriver, and co-founder of the HPV Cancer Alliance. It's Jason Mendelsohn, founder of supermanhpv.org and HPV tonsil cancer survivor, and he himself also a Superman. It's Busisiwe, Moyo, he's the founder of Hope for Cervical Cancer Support Group, a pastor, a development consultant, and social sciences researcher, and also a strong survivor and thriver. Joel, you just heard, Joel Palefsky is the former president of the International Papillomavirus Society and current chair of the IPVS Advocacy Campaign Committee. And he's also the founder of this day, the International HPV Awareness Day. So thank you for that, Joel. Sema Sgaier is the co-founder and CEO of the Sgaier Ventures, which brings together the tools from behavior science, data science, and artificial intelligence to save and improve lives. She's a great inspiration. And Zodwa Sithole, head of advocacy at the Cancer Association of South Africa. She is an on-the-ground change maker and advocate who crosses various issues and sectors of health and general nursing, midwifery, and primary community and palliative health care. So what a panel we have with us. We don't have a lot of time, so we'll have to be fast, furious, and fabulous. But before we start, I'm going to ask all of you a favor. Make some noise. Please use hashtag one less worry, hashtag HPV Awareness Day, and maybe please tag the ask about HPV. And that's one of the things that we're up against, because one of the things we're up against is the stigma, the fear of talking about HPV, because it is often connected to talking about sex. Let's not let stigma shut us up. This is too important, so make some noise. And now, without further ado, I'm gonna ask a couple of the panel here. A fire round. Sema, Joel, in 30 seconds, tell us why discussing HPV and the HPV vaccine is so important right here and right now. Would you start, Sema?
Absolutely. Thank you. And what an honor to be here today. Thank you so much for having me. So why is it so important? Well, the world is no longer the same place with COVID. And one of the things that we've seen with COVID is hesitancy towards vaccine. And we're seeing it all over the world, both in rich countries, poor countries, middle income countries. My worry is that the vaccine hesitancy that we're seeing with COVID is actually going to spill over to routine vaccinations like childhood and HPV, and we must take all the steps possible not to shake the trust of people in the vaccination campaigns.
Thanks a lot. And I've just seen that we have Patrick Amoth with us too. I know he had some connectivity problems, but he made it. Patrick is the chair of the WHO Executive Board and acting Director General for the Kenyan Ministry of Health. So Patrick, your 30 seconds on why is this so important right here and right now?
Thank you so much for having me and joining you today in this important meeting. For me, it's very important because for us in Kenya, cervical cancer is the second commonest cancer in the country, but the leading cause of mortality. And on a daily basis, we lose 9 women from cervical cancer-related complications. Unfortunately, only out of our target of 80% girls 10 to 14 years that we targeted to vaccinate, we have only achieved 40%, of course, because of the issues related to the pandemic. And therefore, it's important for us to be able to discuss this important subject so that we don't leave any girl exposed, knowing very well effectiveness. And
thanks a lot, Patrick. Thank you. And you know, it is as you say, it is big numbers that we're talking about here. So thanks for bringing that. Joel, why here, why now, and why so important? 30 seconds.
2 reasons I would say, Katja. One is there are problems associated with COVID, but there are opportunities as well. So with COVID, we now have heightened awareness of viruses and the importance of preventing them through vaccination and other measures. But more importantly, I would say there's never a bad time to talk about HPV, because the longer it takes to implement prevention measures, vaccination, screening, the more opportunities lost. And so I think we should be talking about this every single day.
Thanks. Absolutely. I couldn't agree more. As also having HPV myself, this is very close to my heart. So thank you all for what you're doing. Because yes, for some of us, this is a professional passion. But Marcia, Jason, and Busi, for you, HPV-related cancer survivors and thrivers, this is also very, very personal. You've had it, and you've gone through some really tough times. So, but you got out on the other side. You're with us today, and as you have shared, you're thriving today. But can you just kind of tell us what made you decide afterwards that you would pick up the advocacy torch and spend your valuable time and effort shining the light on HPV? Would you start, Marcia?
Well, you know, nobody wants to pick up the anal cancer torch, let's face it, right? And for whatever reason, that was what's been put in my path. And I think because of the soul that I have and that I can't bear to hear, even just hearing Patrick and the enormous numbers of people, it just hurts me too much. So the fact that I have the ability to help contribute to this and save lives and educate people, I could not do it. It's not that I wanted to do it, it's that I could not do it. And yeah, that's just it is. That's just, I didn't have a choice. So I'm happy to be here and to help.
Thanks. Could not do it. Jason.
So I decided to go public after surviving HPV-related tonsil cancer, by the way, a diagnosis I had never heard of. And so the stigma for me wasn't a stigma. I learned shortly after being diagnosed that 3 out of 4 adults by 30 had HPV. So I thought, why would I ever be embarrassed? Most importantly, I made videos to my kids. My boy-girl twins were 12 at the time. My son was 6. And I made videos to my kids saying goodbye that went something like this: one day you're going to get married. I'm not going to be there. This is what's important. And I thought it's my responsibility to share my story from the tallest, highest mountain to prevent other parents from ever having to make videos to their kids saying goodbye when there is a vaccine that can protect their sons and daughters from HPV preventable cancers. So it was, honestly, I felt responsible to prevent people from ever having to make videos to their kids.
Thank you for sharing that.
You're welcome.
Busi.
Yeah, thank you so much. There are two reasons why I just couldn't keep quiet after walking the journey. The first reason was the loneliness. When I was diagnosed with cervical cancer, that was in 2017, the first thing I did was to look for fellow survivors, but there was just the silence. You know, you want to relate to somebody who has walked the journey, but you know, it seemed like the survivors were nowhere to be found. It was just difficult to get someone to relate to. And then the second reason is after going through treatment and meeting so many people who had this, I got to know the statistics, especially in our low to middle income countries. The statistics are not good when it comes to cervical cancer. Like I'm here in Zimbabwe, and the leading type of cancer in Zimbabwe is unfortunately cervical cancer, and is also the leading cause of cancer deaths. And I found this, that it's not acceptable considering that there's a vaccine. And worse still, if you contrast it to the more developed countries, I thought, no, this is not acceptable. We just have to create awareness about cervical cancer and the availability of the vaccine.
Thanks. Busi and Jason, you both touched upon stigma. Have you, Busi, have you experienced it yourself after coming forward?
Yeah, stigma is real. It's not something that I thought was out there, you know, but there is that link to sexual activity. And it's also fueled by lack of information, where people think that just because there's that link to sexual activity, probably have just picked it up maybe a couple of days prior to the diagnosis. Yet this is not the case with probably cervical cancer, where it can take years. And people think that maybe I've lost morale. So it is a big deal. I did go through a lot of stigmatization, yeah.
And to all three of you, do you think that that stigma affects the prevention and the uptake of the vaccine, or how it does?
I mean, it certainly does, right? I mean, because there's parents that can't get over their challenge associating HPV with sexual activity, and why will their kids who are younger than 15 really need to have a vaccine. But in my opinion, again, which you already know, if we could prevent breast cancer with a vaccine, or prostate cancer with a vaccine, or lung cancer, we can protect these kids from cancer. So when I share my story, I really think that focus on protecting the kids that you're responsible for, right? That's a parent's job, protect your kids. And if you can protect them from this cancer, no matter what its origin, it's time to protect our kids. That's our responsibility. So I think if that message, not just the science, but the actual responsibility as a parent or a grandparent can be, you know, shared in the proper way, that vaccination will be increased dramatically.
Mm-hmm. Marcia?
Well, first of all, you know, nobody wants to say anal. Let's just start with that particular cancer. So, you know, that's my job, to just get people comfortable with that word. But, and on a larger note, of course there's stigma. And I had one day of like, how could they? And then I was like, snap out of it, put on your big girl underpants and move on. Like, what do you think? You know, it's like, it's just silly. Like, of course you're going to be, you know, people are going to make stupid jokes and feel uncomfortable. But I don't know, I'm a New England practical girl. It's a virus, you know, it's like, come on. So I just have to approach it with my sensibility and, you know, sticks and stones. And it's just about educating. And that is our job, really, to also to keep it out there and to speak and educate the public, so that that's just not the way it is, you know, very soon down the line. So of course there's, you know, there's stigma. I don't understand the stigma personally, and that's probably why it's easier for me, because I go, you know, maybe if I, you know, I always say that if it was like that I'm messy, I might have shame about it, but it's a virus, you know, it's just like, let's just move on and, you know, talk about it and educate and do the job that needs to be done. And That's all.
I get do the job that needs to be done. So why here, why now? Why right now is so important?
Well, I certainly think people have been, not going to the doctor for a couple of years, right? So we have that. But also, that's the bad part. The good part is that everybody has heard about vaccines and viruses, right? So they've been educated in a way that maybe they hadn't before. So I think turning that also to our advantage is an important thing. Like you don't have a stigma because you got COVID, you just caught it, right? I'm sorry, I don't have to turn up those messages. So I think it's important to kind of build on that knowledge and say, this is what it is. These are what viruses are. This is what a vaccine can do. And to take the good part of the last 2 years and build on that. And also the numbers are growing, and this is just way overdue. It's not like, for me, it's not why here, why now. It's like, why hasn't this been public knowledge for so long? I'm a almost 60-year-old woman. I've gotten 1 million pap smears. Nobody ever said, hey, we're checking for the human papillomavirus because that's what causes irregular cells. I know you're going to go like this in a second. But there's so much education to be done on so many levels that's just been missing for so long. And that's what
You're joining us from Zimbabwe. Why right now, and why in Zimbabwe? What is it that needs to be done, in your opinion?
Yeah, foremost, people are talking about vaccination fatigue. We've been talking about COVID vaccinations, and it's sort of like people are getting tired of hearing of the word vaccinations. And I think we cannot afford to get people to get into that mode where they don't want to hear about vaccinations at all. Especially if we look at the burden, the cancer burden is increasing in Zimbabwe, even in Africa in general. And we cannot afford to just sit back and say, no, we're tired of vaccinations, So we just have to talk about it right now.
Right. And Jason, I don't hope, if we could get to the place where nobody needed to make the same videos as you had to make, what is it that we need to do?
I think with COVID, people are used to being at home. They're used to being with their families. If there has never been a better time than to discuss the importance of protecting our families. People are more grounded and working more slowly because of COVID. So I do think that the discussion needs to be had. They need to, again, connect it to protecting them from cancer. Move away. Yes, we understand HPV. I had quite honestly never heard of it before being diagnosed other than for cervical cancer. And so it's just like everyone else said, huge importance on education and knowing that you can protect your kids from preventable cancer. It's like an unknown for any other cancer. So I just think we need to stress that at the highest level.
Great. Thanks a lot for sharing your experiences. We'll hear more from you a little later, but also you have shared some of the barriers. You've shared some of your thoughts and solutions, and I'm just gonna jump over to Zodwa. We know that and have discussed the attitudes that makes a difference, and that we have to tackle the stigma. But what do you see in terms of the barriers for the HPV vaccination? Where does the hesitancy come from, and how do we get over that from where you sit in South Africa? You're on mute, Zodwa, would you?
Sorry about that. Really, awareness is so important. If I talk about South Africa and Sub-Saharan, most of the people in rural areas, English is not their first language. So you find that the promotional material, it's in a written material, and people that cannot read, and some of the people, and also it's written in English, which exclude people. English is not their first language. So that is really a barrier for me, how people are going to be aware of HPV. And also another thing which is important is the area where you stay, you live. There is poor when you look at urban versus rural areas, it's a big challenge. There's poor access to information, poor access to services. The kids who start school late at the age of 10 because they have to travel about, long distances, about 10 kilometers to be at school. So it's a barrier. And also the road, the structures are not good. The vaccinators, even themselves, they find it hard to go to the schools. Maybe can I just say something here in South Africa? HPV is school-based. So we've got the team which goes to the school at the public school and special school to do the vaccination of those kids between 9 and 14. That's why I was saying it's a barrier if the infrastructure is not good for those kids to access a HPV vaccine.
A lot of
lastly, and this HPV campaign, it excludes private schools. So the kids who are at private school, they have to go to their own doctors, and they have to, maybe the medical aid won't cover the HPV. So it is really a barrier.
It looks as if many countries could learn from South Africa on the school-based vaccination system. Sema, what's your thoughts on the barriers?
Yeah, so I'm going to bring to this a lens of someone who's implemented large-scale public health programs for decades in India and Africa and in the US, and really a behavioral science lens. So I think one of the fundamental questions to ask is, why are people not getting vaccinated? And to really, I would say, appreciate that the reasons are going to be quite different for different people and are going to be quite context dependent. So for example, Dr. Zodwa, shared an example of, transport as a barrier, but for some, it's going to be stigma. For some, it's going to be certain beliefs. For some, it's going to be social norm. And so one of the things I think that's really important is to really understand that at a very granular level and know that a one-size-fits-all approach or one-size-fits-all solution is not going to solve this problem. In public health and behavioral science, we talk about awareness, intention, action, right? So awareness campaigns are absolutely necessary, but awareness campaigns are not sufficient because oftentimes people know, but they don't develop the intention to actually do something. And even if they develop the intention, there's some drop off to getting to action. So my key point here would be really greater precision in understanding the reasons why and being able to develop very targeted campaigns to different types of people and to different contexts and geographies to be able to solve this problem. And I'll say one more thing and I'll be quiet. So in COVID, for example, just to give an analogy, one of the things we did was really understand the types of people in the US that did not want to take the vaccine. And rather than saying it's white versus Black or rich versus poor, urban versus rural, we really tried to understand the typologies of people. And we uncovered 5, all the way from enthusiasts to folks who don't trust the system, to folks who actually are cost anxious and time anxious, who have cost and time barriers, to extreme skeptics. And so to summarize, really, really important to bring much more precision to understanding this problem and much more precision to developing very targeted solutions to increase the vaccination rates.
Great. Awareness, attention, action, and a lot of precision. It's great. Thanks. And may I add, Patrick, what are the, you sit in the middle of it in Kenya. So what are the solutions that you see in implementation and also an implementation that can overcome the barriers that we have, whether they are behavioral, systemic or access. Also, what we have not heard yet about is misinformation. So what do you see as the way to overcome some of these barriers to vaccination?
Thank you for that question. I think we need to, one of the ways to be able to overcome some of these challenges is, of course, to use a multi-pronged approach instead of a single strategy intervention, starting from the individual level, where, for example, in Kenya, we are working very closely with the Ministry of Education to ensure that the Ministry of Education and development of its curriculum, vaccines forms part of the curriculum, so that when children are in school, the youth and the young adults, they are actually taught about the importance of vaccines and why they should actually be able to advocate themselves to be able to get the vaccines. Then there are measures that we need to take at community level, which includes working very, very closely with community resource persons, civil society organizations, religious leaders, because sometimes, like in Kenya, our experience was that one of the greatest opposers to the administration of HPV vaccine was actually the Catholic Church, which has a very strong following. So we had to be able to sit down with them, to be able to tell them the importance of this vaccine, more so because this vaccine was also targeting only girls in our setup 10 to 14 years old. And the issues of fertility really came out very, very strongly, especially among the Muslim community, where the total fertility rate compared to the national TFR is much, much higher. Our TFR is about 3.9, but if you go to northern arid lands, women still have 6, 7 children. So again, working with the community so that you can be able to address these myths and misconceptions. And we have learned this during the pandemic, how misinformation spreads very, very quickly. So it's important for us to be able to devise interventions to be able to engage with our communities. Fortunately, we are now in our journey towards universal health coverage, which is pegged strongly on a primary health care approach with the health prevention and health promotion and a strong community component using community health workers. And we want to use that platform to be able to identify the girls, especially those who are out of school, so that we don't leave anybody behind. And somebody talked about the approach of using the school-based. Initially, in our experience, we wanted to use the health facility-based approach, but we found out that the school-based approach was delivering better results. However, this was affected negatively during COVID-19 when we put in place these interventions to be able to mitigate against the virus. Schools were closed for about 9, 10 months, and therefore we lost that platform. But we also realized that it was not only that particular vaccination that's affected, but also the routine vaccination. So we quickly came up to be able to design continuation of essential healthcare services during a pandemic, and with the support of Gavi, WHO, UNICEF, we have conducted periodic intensification of routine immunization to ensure that those who are left behind we catch up, and that began in November last year with very, very good progress. We should also not forget the supply side, because having the vaccines is one thing, and during COVID, the vaccine that saves life is that vaccine that is actually in somebody's arm. We should ensure that we have adequate supply of vaccines. We have a functional logistical supply chain system, and we have well-trained, adequate health workforce to be able to offer the service. Thank you.
Thanks, Patrick. And you know, as we say in many other health campaigns, the parents, the preacher, and the teacher are very key in community outreach. Dr. Patrick, we have a question from the audience, and I think maybe I'll ask it for you, because it touched upon your multi-pronged approach. It's kind of, should HPV vaccination be recommended during kind of the conversations around, you know, family planning, or kind of some of the other health services related to reproductive health? And maybe it already is in Kenya.
Indeed, that is the best way to go, so that we have it in an integrated approach, so that when you come for another service, this can also be part of the discussion. Because if you don't talk about these other services, it will simply remain there in a silo or a compartmentalized situation, and therefore chances of missing out important communities who require the vaccine, we will be able to miss out on them. So we should be able to integrate it in the entire reproductive health spectrum, so that when you come for this other service, you can be able to actually create awareness, and you demand for that service and get it in return.
Right. jumping over to Zodwa, because that was also some of the things you spoke about. What are the solutions that you see on the ground?
Just to add on Dr. Patrick, that I think those services, they need, like he was saying, we need to include HPV to things like family planning, primary health care, health promotion. So the suggestion or the solution is that those services, their policies, they need to be adapted and also include HPV as part, of their services. And also another thing I really like us to, to take as a solution, let's use the young people, let them advocate for HPV. I think the young ones, they listen better because they can fight, they can remind their parents that, hey, Ma, Dad, I need this, I need this. And also another thing, which the solution, we need to be really strong with awareness. Let's work with the media. Let's have a roundtable discussion, with different stakeholders and see how do we address this. And I mean, I was listening to Sema talking about the hesitance. We need researchers to go out and do the research. Why people are hesitant in having a HPV, and also to address, the confusion. The parents are confused with a COVID-19 vaccine and HPV. So we need people to do the research and come up with a strategy to deal with those misinformation, those challenges.
Thank you very much. Thanks. And if I may just go to Sema also, because Zodwa mentioned you, but also can we use the system that's been built up around COVID for this?
I mean, absolutely.
Learn from it.
Absolutely. I think COVID was, like many said, it's both a challenge but also an opportunity, right? So with the hesitancy that we've been seeing with COVID, I think there's been a lot of really rightly so in the last year or so research being poured in to try to understand the hesitancy and the reasons why. And I do want to highlight, for some it is hesitancy, but for some it's other barriers. And so really taking a much more comprehensive approach. And I loved hearing Dr. Patrick talk about some of those diverse set of solutions that Kenya's implementing, and Dr. Zodwa as well. So I think there's a great opportunity to build on the research and the tools. There's also much more research in actually leveraging media and social media now with COVID to really understand the spread of misinformation. And we've seen how fast misinformation from places like the US and Europe are spreading actually to Africa and Asia in regards to COVID and vaccines in general. So yes, there's a great opportunity to build on both the research and the platforms that have been around this.
Great. Patrick, you made a mark.
Yeah, just to highlight the point raised by the previous speaker, I think the importance of the use of social media platform, Facebook, Instagram, Twitter, especially with these young people because of the high mobile phone penetration in sub-Saharan Africa. I think that is a good platform that we can be able to use with the young people so that they also become our own advocates, not only consumers of the vaccine, but they actually become our ambassadors of the importance of having the vaccine. If we can be able to use that platform, then we can be able to have a bigger buy-in, especially amongst the youth. Thank you.
Joel, would you I know that you mentioned it in your opening about, what can we learn from the situation with COVID today and how can we build on it?
Yeah, I think in addition to the really good points raised by the other speakers, I think another opportunity here has been to help us gain more experience in vaccinating different age groups. One of the challenges that we had initially with HPV vaccination was trying to reach a slightly older group than the usual folks on the pediatric vaccination schedule, namely the 9 to 12-year-old age group. And I think as the age of vaccination for COVID progresses steadily down the age range, I think that some of that experience can be brought to bear with HPV as well. So that's one thing. I think also we've learned how to communicate better with different groups. And we understand better than that one size doesn't fit all, that we really do need to target our communications quite differently, and probably need a lot more research how to optimize those for those different groups. But we're getting better, I think, with social media. And then one other advantage, if you will, or opportunity that we can take from COVID is more of a biomedical one, which is, of course, an extremely impressive effort to produce vaccines quickly using some new vaccine technologies. And I think it'll be very interesting to see if some of these manufacturing methods and new approaches to creating vaccines can be brought to bear for HPV as well. So lots of very interesting things going on.
And some of them systemic changes or adaptations, and some of them individual, and some, kind of when we talk about the information and misinformation, very much also societal and community. That's extremely important to have.
Actually, one other point that I think we've also become much more cognizant of is that, you can vaccinate people in your community, but you're not safe until everybody's vaccinated. I think COVID made that super clear. And I think it applies to HPV as well. It's not okay to have everybody in North America vaccinated if there's still people not vaccinated in sub-Saharan Africa. So if we all want to be healthy, everybody needs to be part of it.
Leave no one behind, and also really underscores the need for good advocates, as we have with us Busi and Marcia and Jason today. Do you have any thoughts, kind of having survived and thrived, on some of the things that have been mentioned here?
I was going to mention when they were talking about, when we were talking about kids being advocates, I don't know that it's ever been done, and I didn't think about it until just now, but maybe we could ask the children of survivors of HPV-related cancers to speak out about the importance of being vaccinated. Because, for instance, in my case, I was thrilled to vaccinate my young kids, right? Because I knew I could protect them from the cancer that I had suffered from. And so maybe that would be an idea, right? Obviously, they have to be willing, they have to be able, but that might be an emotional way to connect the importance of the vaccine to protect themselves and others from cancers that they know firsthand.
Absolutely. And as some from the audience just kind of made a comment about, is, it is still very much considered a girl's issue. How do we absolutely make sure that this is also for boys, and it's a male, it's very relevant for males as well.
My last comment was just that you put someone who looks like the everyday male on TV everywhere and let them know and show all the different, the looks, right? Younger, older, different colors, different religions, different everything, and let them be like the faces of HPV.
Yeah. There's a very interesting question from another good question from the audience. It is, the HPV vaccine lasts approximately for 10 years. And what's the plan after that? If you get it when you're 12, 13, it expires when you're 23.
Maybe I could take that one, Katja. So the questioner is correct that that does last for 10 or so years, but in fact, that's the bottom of the range. We don't really know how long it lasts. It probably lasts longer. In fact, the vaccine lasts as long as we've been able to follow people out. At this point, that's been about 15 years, and the vaccine still seems to work. It might last even longer than that. So we don't really know what the floor is, or rather what the maximum is yet. We'll need to continue research to follow people. There may come a time when a booster is needed, but as of now, for as long as we've been following people with vaccination, this is true for both men and women, the vaccine appears to retain its activity.
Thanks. And if I may just stay with you, Joel, because, following the media and social media today, I know that today has brought some really good news in this field. would you just take a minute to talk about some of the really good news items from today? Just elaborate a little bit.
Well, I think you're referring to our press release, which we like to highlight some good news. And there have been two pieces of good news that were the focus of this press release. The first is that there is increasing evidence that for people 14 and under, 1 dose of vaccination might be sufficient to provide protection for a still unknown period of time, but it appears to provide protection at least for the amount of time that we've been following people. And the United Kingdom actually is now recommending 1 dose universal vaccination for people under the age of 14. Do want to provide a little bit of a caveat here. It's there's still a lot of data coming in on this. There's still a lot more to learn about it. We don't yet know how long that protection will last. So just as we talked about before, we'll have to figure that out. And the other is there needs to be some caution. I think the UK is a fantastic place to introduce a policy like that because there is a lot of backstop, if you will, in place, namely the ability to follow people carefully to make sure that they remain protected. And also there's a good screening program in place because we have not yet stopped screening for vaccinated women. So I think this is a great step forward. And if it turns out to be as great as we all hope it will be, it'll be a huge game changer because it'll make the vaccine much more affordable because we only need 1 dose and more easily implemented because we don't need to bring people back. That was one piece of good news. The other is that we now have some evidence from a study called the Anchor study. I happen to have been the principal investigator of that study, which showed for the first time that when we apply measures to screen for and treat precancers in the anal canal, similar to the way we do cervical pap smears and treat high-grade precancers in the cervix, that there's evidence that we can reduce the risk of anal cancer too. So it may be in the future, this is not standard of care, but we hope it will become in the near future that people who are at high risk of anal cancer might undergo screening and treatment similar to the way women get screened and treated in the cervix. That'll be true of anybody potentially at high risk of cancer, but most likely, at least initially, people who are immunocompromised, such as those living with HIV.
Thank you. Thanks, Joel. And I'm just going to jump to Patrick. You would like to chip in on this, and Marcia.
Yeah, thank you. I just wanted to add on top of that, that is also important for government, especially to ensure that we strengthen our healthcare system, especially with a strong focus on primary healthcare approach, with a strong participation of the community, because most of these interventions can be delivered at lower levels of care. So if we can be able to focus our resources in terms of health workforce, in terms of finances at the primary care level, we'll be able to accrue higher dividends in terms of the investments we make if we really focus on the primary healthcare level. And also the importance of working with other sectors, like in Kenya, we are developing a joint policy with the Ministry of Education where proof of HPV vaccination will be required for a transition from primary school to secondary school. And because we still use the schools as a platform for vaccination, then if somebody who comes in and has not had vaccination, again, we'll be able to use that platform to ensure that they are vaccinated as they transition. But it will be a requirement that if you are going from primary school to secondary school, because average people who go to secondary school are about 14, 15 years old, you should provide proof of HPV vaccination. And also during the COVID-19 pandemic, what we have learned is that working together as one whole government, one whole society, we are able to achieve much, much more than working individually or in a siloed or compartmentalized way. So the importance of getting everybody to be able to discuss HPV, the way everybody was discussing COVID, including COVID vaccine, is the same approach that we need to use for HPV. Thank you.
We will be looking towards Kenya so the world can learn from how you do it. Marcia, the good news on the anal screening. What's your reaction?
But what I want to say in regards to that are a couple of things. One, I wouldn't have any idea to get an anal screening. right? So we're talking about vaccine, but there is millions and billions of people, maybe billions is too much, who are past that, right? And who have no education about HPV. And I'm also interested in them because we're completely uneducated. They don't know about throat cancer, anal cancer, any of it. So while we're trying to get everybody vaccinated, there's also a whole group of people out there who need to be educated and need to know to get pap smears and what they're for, and to get, I never tested positive for HPV. My husband had a lump in his throat. We didn't know what was going on, and that's a problem. So as we're, trying to vaccinate the world, there's also an entire world out there that, is at risk right at this minute, and, need to be educated and have their lives made very important too. That was a bad sentence, but you know what I'm saying.
Absolutely.
And it's what's going on right now. My husband told me last night that his surgeon was seeing a woman whose throat cancer was so bad that she couldn't operate on it. She was dying, and she didn't go in to get care. Like, maybe she didn't even know what it was, but there she was in her hospital room with her children around her throat closing up, and she couldn't do anything for her. So I want to also not miss these people right now.
Thank you. Zodwa, a very fast comment before we move
Yeah.
on.
Thank you. I just want to stress the capacitating of the healthcare workers, because they can help to deal with the hesitance to HPV vaccine. And also they can be the advocates, to promote the HPV. I wanted just to say those two things that's so important. Thank you.
Absolutely. Thanks a lot for sharing. And thanks a lot for sharing. And thank all of you for sharing your insight. So we'll be kind of, time goes fast when you're in really good company. And this is really stellar company on this HPV Awareness Day. But no talk without action. We're going to end this fabulous hour with a fire round, and I'm going to give each of you tops a minute. If you can do it in 30 seconds, you get really good points. So one, what do you commit to do over the next year and beyond? And two, what do you want our very active audience to do? I want to say thank you to the audience for all the questions. We won't have time to take all of them, but you will get an answer afterwards. We will collect them. But for the panelists, tops 1 minute. What do you commit to do the next year and beyond? And what do you want our very active audience to do?
Maybe I can start.
No, I think Joel, I'll let you end.
Okay.
I may. The moderator's prerogative.
Sure.
Busisiwe, I start with you.
Okay. What am I committing to? Making sure that information is readily available in our country, and survivors, let's come out and talk about HPV. And to the audience, I'm asking for us to come with strategies of presenting the risk factors without necessarily perpetuating stigma around those risk factors. Thank you.
Thank you. Sema.
Thank you. Oh, sorry, I can go. Thank you so much. What am I committing to? So taking all the lessons that we've learned and our research methodologies and trying to understand vaccine barriers to COVID, and would love to actually apply that to HPV. So that's what I'm committing to as a person. What would I like from the audience? So I'm sure in the audience, there are many folks who are part of ministries or government programs or organizations for tackling this problem. What I want to say is that it would be really important to bring in a behavioral scientist or behavioral perspective into the efforts to tackle this. So that's what I would love the audience to do. Thank you so much.
Thank you. Patrick.
Okay, thank you. Sorry for that technical For me, my commitment is to continue to advocate for HPV vaccination as a technical lead in the Ministry of Health, and as long as I sit as the chair of the executive board of WHO. But in addition to that is to be able to track performance and ensure that no one is left behind, because if you look at this disparity between rural, urban, hard to reach areas, to ensure that we don't leave anyone behind by having statistics that are national and therefore mask the performance of individual subnational levels. So I'll be very, very keen to ensure that we are not leaving anybody behind. And for the audience is to continue the conversation, because each voice counts. If we talk about it, people are going to listen. Thank you.
Thank you. Jason.
I'll try to be quick. I commit to sharing my story and hopefully encouraging others, survivors of HPV-related cancers, to share theirs. There's two things I'd like the audience to do. One of which, for parents and grandparents, I'd like you to speak to your kids' pediatricians about the HPV vaccine for both their sons and their daughters, not just their daughters. And then the second thing would be, if you are, or if anyone, and oftentimes it's males between 40 and 60, and you have a lump on your throat that appears out of nowhere on their neck, sore in the mouth that will not heal, go to your ear, nose, and throat doctor. Go there first. Don't end up there last. Go there first and have your dentist do an oral cancer screening. That's it.
Thanks. Zodwa.
What I commit to do is to advocate, spread the news to the far to reach areas, try to use their local languages. So that's my commitment. And also what I'm requesting to the audience, let's all hold hands and spread the news of HPV within our communities, our families, and our kids. Thank you.
Right. Thank you. Marcia.
I'm going to make it quick too, because I know we're running out of time. I'm going to echo that, like talk to 5 people, have them talk to 5 people. Just keep talking about it, because that's going to eventually help with the stigma and education. And then I just didn't plan on doing this, but on my Instagram, I put hashtag HPV equals this signal and no shame. And I challenge everybody to do this. Anybody, whether you have it or you don't have it, just to, to spread this around. The more people that say, I'm not afraid of this, there's no shame about it, then the better. And for me, it's about making some sort of visual presentation so that it can reach all over the world and be understood simply and directly. Thank you.
Thank you. And Joel, you go least but not last, and I'm just going to make a little tweak on it. So, what do you commit to do? What you like the audience to do? And what would you like to have seen happen when we meet next year for the HPV Awareness Day?
So what I think I can commit to, both personally and also on behalf of IPVS, is to continue to try and spread the word, to shut up less, to make more noise, and to do this year round, and to make sure that we're covering the entire spectrum of people with need. As I mentioned, this year we're focusing on vaccination. That's only one of the 3 pillars. Next year, we're going to focus a little bit more on screening to try and address some of the concerns raised by Marcia. So we're going to talk a lot more about everything. What I would like people to do is, as Jason mentioned, talk to others, start the conversation, direct people to the website. Ours is called askabouthpv.org, and our partners have wonderful websites too. So please get the information. And the last question is, where would I like to be next year? I'm hoping that by next year we'll have a lot more good news on each of the fronts that we've been talking about: vaccination, screening, and treatment. There is progress all the time. I would encourage our listeners to continue to lobby all of the local authorities for more research support and more support for implementation science to make sure that all this good news gets maximally taken advantage of. So those are my hopes for next year.
Thank you very much. And thanks to a wonderful panel. And to everybody, make some noise, talk about it, tweet about it, and engage in the One Less Worry campaign. Not just right now, but throughout. This is everybody's business, and it cannot be business as usual. Thanks a lot for joining, and have a beautiful day.